for hormone replacement therapy or hormone optimization for anti-aging, there are still many doctors in Malaysia are not pretty or very well aware of it. So maybe you can know more from Dr. Neal why he's around in Malaysia this time. Yeah, for any particular reasons?
Well, the reason I'm here this weekend is to teach a course to doctors on how to do BHRT.
Okay.
It's a 3-day course. It's very intense. What we do is review all of the science and medical literature supporting the harm of when you lose hormones, supporting the benefit of when you replace them, supporting the harm of synthetic hormones, which we don't do and we don't want to do, but also understanding that there's a difference between them, but most doctors don't understand that, which is a shame, and that's why I'm here this weekend, because I come about once a month to teach courses to large groups of doctors on the science, the medical studies, the medical literature on how to do this so that all doctors here can become trained, just like I've been doing and training doctors in the United States for over 20 years.
Yes. This is part of the courses that I attended on Dr. Neal's course. So I personally feel very well trained and learned a lot.
You are,
yeah.
yes.
So, and I believe with more doctors being trained by Dr. Neal in this very well organized hormone optimization course, I believe this availability of services and hormone optimization will be getting more established and well known to all the public in Malaysia. Yeah.
Well, the courses here in Malaysia are attended by doctors from China, Malaysia, Indonesia,
Exactly.
the Philippines,
Yes.
Vietnam, Thailand. So it's becoming very popular here, which is why I'm here. But in the United States, every weekend I'm teaching. I'm teaching large groups of doctors on all the science behind all of this and how to correctly practice it correctly.
Yeah.
So it's very important for the doctors to be well trained and knowledgeable to be able to explain what this is, but also know the science and the literature that all doctors should know for all the benefits of replacing your hormones, which most doctors and unfortunately patients do not know and understand.
Yes, exactly as what Dr. Neal says, he gives quite frequent teaching in US every week. In Malaysia, in Asia itself, Malaysia, we are considered very fortunate because we can have him almost once a month, and we can consider already very well keep with the pace of the speed in learning about hormones. Yeah, so the way we learn hormones, keep updated with hormones is very well appreciated from your efforts, Dr. Neal's efforts. So the way he teaches us, and if you can imagine the ways we attend your course and we understand about the literatures of the hormones is tremendous. It's like in and out thoroughly and is like clear about it. We are so great about it. Yeah.
Well, good, thank you. And you have seen the patient response.
Exactly, yeah.
That there's nothing the patients can do. There's no drug that you can take. There's no medicine that you can take to make you feel better or function better.
Yeah.
You can take blood pressure medicine that has side effects, diabetes medicines, cholesterol medicines all have side effects.
Yeah.
They're necessary because they reduce the illness, but there's also side effects and problems. And it would make more sense if we could do it in another way, that we don't have to take the medications
Yes.
and not have the side effects of those medicines.
Yes.
And you've learned how to do that, and you've seen that in your patient population on
Exactly.
how you can make people feel better and help them not have to take these medications
Yes.
and prevent from having to take them in the first place. That's what preventive medicine is all about.
Yes.
The name of my clinic in the US is Preventive Medicine Clinic. It's really quite simple. We just optimize hormones, nutrition, diet, exercise, and that's all a part of preventive medicine that makes us live longer, happier, and healthier. It's so simple.
We are so happy to have Dr. Neal here. It's our great precious to have you here in Malaysia and bring up our efficacy and the quality of Malaysia's medical field.
It's my pleasure.
Yeah.
Thank you very much.
Thank you.